Hi everyone, it's me, Melanie, your IVF nurse, and what I'm going to be speaking about in this episode is natural frozen transfers versus medicated frozen embryo transfer protocols. So with a natural cycle, it does require a bit of a commitment in terms of monitoring, as you'd need to report day one, and then you would be advised by the clinic or your nurse coordinator as to when to start either your blood test or when you're going to be doing an ultrasound. Some clinics may initially have you come in and do blood test and ultrasound, and some may actually allocate a date to you. So it could be day 8 of your cycle, day 9, or even day 10, depending on how long or short your cycles are. And some clinics will say you're going to initially start off with just blood test on your specified date. So it could be for a 28-day cycle, your clinic could tell you to come in on day 10 just for blood work, and then they will monitor you daily with blood work until they see signs of ovulation. They're going to order an ultrasound to assess the lining of the uterus, and what they're looking for is how thick the uterine lining is, as well as what's called a trilaminar appearance. So in terms of thickness, most doctors do have a preference of seeing it above 8 millimeters. For those of you that have a history of lining issues where you can't quite get it to 8 millimeters, some doctors will be okay with 7 millimeters in thickness. Now, in terms of a trilaminar appearance, that's where they're looking at a triple line, and this is visible on the ultrasound, and it indicates to the doctor that your body is actually ready for transfer, or that it's able to accept it, that it's gone through the appropriate phases in order to prepare for conception. Now, once you've done your ultrasound, your clinic, depending on your actual hormone results, so from your blood test, they may actually need for you to return to the clinic in the subsequent days to do more blood work just to confirm ovulation. And then once they've actually seen that peak and drop, then embryo transfer is usually about 5 or 6 days afterwards. With a medicated cycle, you would report your day 1 and you would be advised to start your estrogen supplementation. This can be orally, sometimes it's vaginally, depending on your medical history, and sometimes it can be both. What will happen next is that you'll be assigned a date to have your ultrasound to assess your uterine lining. This can be as early as 10 days of taking your estrogen supplementation. Most clinics will say about 14 to 15 days of estrogen supplementation, and then they want to check your lining. So when you go in for your ultrasound, you're going to continue on your estrogen supplementation as you've been doing. With regards to the ultrasound, they're looking to see the lining of the uterus and if it's trilaminar as well. So in terms of the lining of the uterus, again, they're looking at about 8 millimeters is preferred or thicker. And for those of you that have a history of endometrial lining issues, then 7 millimeters is sometimes acceptable depending on your doctor's preference and your history. Once you've got your lining check done, receive confirmation of when to start your progesterone. Embryo transfer is usually 5 to 6 days from date of starting progesterone supplementation. If you've had an ERA biopsy, then your embryo transfer date would be reflected from those results. So if you're pre-receptive, then maybe your embryo transfer is going to be 7 days of progesterone or 7 days post-ovulation, all depending on what they see from those results. With a medicated cycle, you may only be required to do the one ultrasound. There's no blood work involved unless you need to update infectious disease screening, which is important. And you want to make sure that you follow your clinic's protocol or policy on infectious disease screening, whether it's every 6 months or annually. Some of the things to consider with each of these protocols is that there's more of a commitment of monitoring. So yes, you're going to make several visits to the clinic for blood tests and ultrasound, and possibly more blood tests after that. And then there's always, depending on if you can make those appointments or not, there's always a risk that you could miss ovulation, or the doctor may not be able to identify in the blood work when you surged. So you want to make sure that you are available to do the required monitoring if you're going to be doing a natural cycle frozen embryo transfer. Now, with a medicated cycle, that doesn't guarantee either that your transfer is going to be on that date. If your lining is not thick enough, when you go in for your ultrasound, the doctor can delay your cycle a few days and have you repeat the ultrasound to see if your lining thickens. If your lining thickens, then you would go ahead and start the progesterone. And then your tentative transfer date would have also been pushed back a few days to reflect that of the delay in starting the progesterone. Starting progesterone supplementation when you're doing a natural frozen embryo transfer cycle can vary, as some will have you start it after ovulation, and some doctors will only have you start it on the day of embryo transfer once you've had the transfer completed. This is dependent on your medical history, previous cycles, everything that the doctor has taken into consideration to optimize the outcome of the cycle for you. With a medicated frozen embryo transfer cycle, you would continue on the estrase. Once you've had your ultrasound, then you'd get the okay or the clearance from the clinic to begin your progesterone. You need the progesterone in advance of the embryo transfer because your body, with the estrogen supplementation, is not going to follow the natural pattern that your body would naturally and produce its own progesterone. So while continuing estrogen supplementation, you would then introduce the progesterone, and then your embryo transfer would be 5 or 6 days after that. I hope you found this information helpful. Please feel free to continue to send me your emails at yourivfnurse@gmail.com. Feel free to check out my website, www.yourivfnurse.com. Follow me on Instagram at yourivfnurse. You can subscribe or comment down below to my YouTube channel. Thanks for watching.